Good afternoon. Welcome to the Bob Unger Show. We've got a very, very special guest today. There was an old story about Diogenes that he was seen walking around Greece with a candle in his hand, and he was just walking around. People asked him, "What are you doing with that candle?" And he said, "I'm looking for an honest man." We've got one today. His name is Edward Dowd. And also joining me on the Bob Unger Show is Dr. Alan Katz. He's not only a Yale graduate and a medical doctor, but he also has the somewhat infamous reputation of also being an attorney, although thank God he never practiced law. He didn't have to practice. He got it right already, I guess.
Ed Norton.
Ed Norton, yeah. Okay. Well, Mr. Dowd is the author of a book called Cause Unknown and the epidemic of sudden deaths in 2021 and 2022. He has a great range of knowledge from the financial system, a money manager, and believe it or not, a money manager knows something about math and numbers and bets and hedging and protecting the downside. And you'd be surprised how that comes in handy when you're looking at this issue of the vaccine. And the book, what's great about your book, Edward, is that you have the photos of all these families, their children, their wives, their sons, their daughters, and the devastation that must have occurred to them from all these sudden deaths. And in between that, you give a lot of great information, but I love the fact that you make it human. It's not just numbers, and that's what people forget. There's human beings behind these numbers. It's like when you talk about the Holocaust and 6 million Jews and other people being murdered. 6 million just sounds just a number until you actually see the death occurring. And so, how did you get interested in this subject? What epiphany, if any, did you have that made you begin to go after this thing and have the intellectual curiosity to go down the proverbial rabbit hole?
A couple things. I mean, first, when COVID hit, like everybody, I was a little initially scared, but because I'm on Wall Street, I knew that COVID was coming in January of 2020. So I went to Costco 6, 7 weeks before anybody on Maui. I live on Maui. Before anyone on Maui knew there was a virus coming. So I stocked up. And then, everybody, once the mainstream media alerted them, they went out and bought everything. But very quickly, I started to notice all sorts of strange things, propaganda, the fact that no one on Maui that I knew had COVID. There were just all these strange things going on, lockdowns, and so I was just super suspicious from the get-go that because we were, in the financial community, we were monitoring the end of this everything bubble. What happened in 2008 never got resolved. They solved the debt problem with more debt, and so the debt moved from bank fraud to sovereign debt fraud. So we were waiting for this to blow up, and it looked like it was going to blow up in 2019. And then, COVID gave the central banks cover to print unprecedented amounts of money, and the politicians cover to, raise spending bills for trillions of dollars. So I started to become very suspicious from the get-go. But then when they suppressed all the early treatment to make way for a vaccine, I knew something was suspicious about that. And then they decided to use a novel new technology that had never been tested on anybody, a genetic therapeutic, so to speak. So from the get-go, I was suspicious. And so I wasn't going to take the vaccine no matter what, primarily 3 reasons. Warp speed sounded like a disaster. Again, novel new technology where the animals all died. And then I also knew that from my experience on Wall Street, that normal vaccines take 7 to 10 years of vetting safety data before they're introduced into the arms of humans. So I just said to myself, I'm going to wait. then in January, February, March of 2021, I heard anecdotal stories of, where I didn't know anybody who died from COVID in 2020. But in 2021, all of a sudden, COVID's ravaging the island of Maui. That's number one. Number two, I started hearing of, injuries in my friend group, reactions to the vaccine, and then, the uncle on the mainland who died. And I didn't know anybody in my extended friend group who died in 2020. Then all of a sudden, I started hearing about deaths. Then I noticed the sudden athletic deaths on the soccer fields in Europe in around March, April timeframe. And so, I was just horrified. And I know from my statistical background that I shouldn't be hearing anecdotes. If it truly was safe, I should never hear. Yeah, do vaccines cause adverse events? Yes, but they're so rare when they're tested properly that I shouldn't be hearing it. So I knew statistically something was up. Then when the mandates came, that's when I really became activated and started to go to protests and met Dr. Malone on Maui and became friends with him and told him that I was going to, if I was right that the vaccine was a disaster, I would monitor databases like insurance company results, funeral home results, and eventually we looked at all-cause mortality at the CDC and other government databases around the globe. And unfortunately, the data is in and the data is devastating. So I'm just a guy that notices trends. And my job on Wall Street as a trend follower was to identify the trend before everybody else, position myself such that I was there before the herd or the sheep, so to speak, because Wall Street's full of sheep and most people on Wall Street just follow trends. So my goal was to always get positioned before the herd woke up to the new reality. So I live in the space between perception and reality. Perception on the vaccine for the longest time was safe and effective. Well, the effectiveness we now know is garbage, and the safety is beyond a doubt at this point. But the problem is the global governments know this, but they don't want the people to know this. So that's why I wrote the book.
What do you say to all the people? Because this is always what the response will be. They say, oh, you don't know for sure that it was the vaccine that caused these problems. And, it's always, since it's not being studied, which it should be, what is your response to that?
My response is this. I'm a Wall Street professional, and if I wait for the New York Times, Wall Street Journal, Washington Post, CNBC to tell me what just happened, I've missed my opportunity. So we have enough evidence now, without a doubt, that something has happened to the employed population of our country. Their health outcomes have inverted to the general population to the point where their excess mortality is higher than the general population and their disabilities are higher than the general population. That's without a doubt. So at the very least, we have a national security issue. So if it's not the vaccine, what is it? I blame mandates and the vaccine. And if it's not, then okay, fine. But why aren't we talking about it? This is a phenomenon that's occurring that's never occurred in the history of our country, because employed people, by their very nature of getting up in the morning and going to work, in the metadata, in the aggregate, are much healthier than the general U.S. population. That's just a fact, and that's inverted in 21 and 22. So if it's not the vaccine, then what is it? And the fact that they're not talking about it is all I need to know that it's a cover-up at this point.
How much greater are the numbers of excess mortality? In other words, deaths beyond what's normal over human history after the vaccine was distributed widely compared to the prior years?
So let's focus in on a specific group. This group is called the group life policyholders. It's a subset of the U.S. population. These are the folks that belong to Fortune 500 companies and mid-sized level companies. When you onboard to one of these companies, you get first day you go to HR or you do it remotely. You get your health plan and you pick your PPO or HMO. Then you sign what's called a group life disability, death and disability benefit. And all it requires is a signature and a naming of a beneficiary. And if you're married, it's your spouse. If you're not married, it's usually your parents. And if you don't like your parents, it's a friend. But this is usually a benefit that gives you 1 to 2 times your base salary. And this is a great business for insurance companies. Phenomenal business. And why is that? Because this group of people, because they have access to the best health care and are employed, they die at 30 to 40% the mortality rate of the general U.S. population in any given year. And well, how do we know this? Well, the insurance industry knew this. And the Society of Actuaries actually did a study in 2016 to prove what they already knew, which is this is a great business for them. That, again, these folks die at 1/3 the rate of the general U.S. population in a given year. Well, in 2021, excess mortality for this group of individuals was 40% for ages 25 through 64. To put that into perspective, Scott Davison in January of 2022 said on a Chamber of Commerce call in Indianapolis that he was seeing that exact number, 40%. This was then verified by the Society of Actuaries. The whole industry saw 40%. And he said 10% for this age group, 25 through 64, was a once in a 200-year flood statistically, a 3 standard deviation event, which on Wall Street is 0.03% of the time. So it rarely happens. That's just 10% excess mortality. 40% is off the charts, according to Scott Davison. And what happened to the general U.S. population in 2021? Well, they experienced 32% excess mortality. So the group life people who are employed, and to get this benefit, you have to be employed. This traditionally healthy group of people inverted and died excessively 8 percentage points more than the general U.S. population. Never happened before in the history of the country. And if you go deeper and you want to look at the numbers by quarter, an event occurred in the third quarter of 2021. Millennials ages 25 through 44 experienced an 84% excess mortality. They were running at around 30% in the spring, early summer of 2021. And then mysteriously, they rose to 84% in a very short period of time. It's called a rate of change event. And I suspect, and I blame the vaccines because that's when we had the mandates. And you have to understand, if you're 25 through 44, you tend to be very healthy. We already knew for a fact that this virus, COVID-19, did not affect the young. So a lot of the millennials were what we call vaccine hesitant or lazy. I mean, I remember being that age. I was lazy. If I didn't need a vaccine, I wouldn't get one. They then were forced to take the vaccine due to job mandates. And that's why we saw that event. It was a rapid rise. And this number was, you can see these numbers in the heat map of the Society of Actuaries on table 5.7 from their report in August of 2022. So there you have it with the excess mortality. If you look at the disabilities, which are way higher than the excess mortality, we look at another database, the U.S. Bureau of Labor Statistics. And prior to the vaccines, 2021, the disabled American population was bouncing back and forth between 29 million and 30 million. Then in February of 21, it took off. Year over year rate of change with, again, another 3 standard deviation event, and rose to 33.2 million in 18 months into September of 2022. When you dig into the numbers deeper, 1.7 million of the additional 3.2 million were employed, so more than half. And if you looked at the disability rates, the increases in the disability rates for the employed were 31%, for the general U.S. population, 8%. And this is even more stark for the not in labor force. These are the folks that are able to work and willing to work. Their disability rate went up 4%. These are the people that got fired for not taking the job or quit and they didn't want the job. So I went before Senator Ron Johnson in December, and I told him we have a national security problem. I blame the vaccine. If it's not the vaccine, this needs to be investigated. So we're at the point now where the numbers are the numbers. Something's happened to the employed population of our country and the military and all the first responders. And unless this is stopped, Houston, we have a big economic problem. This is going to affect the economy for years to come unless we stop this right now.
It's everything you say. I've been thinking and seeing myself, and what really disturbs me, I'd like you to comment on this, is how silent my own profession has gone on this. When I speak to other, I'm so ostracized now from my medical community. Number one, I didn't take the vaccine. I was mandated to in the state of New York. I can see patients, but only like in a non-hospital setting. So I'm considered like a pariah and a science denier. And yet all these people, they can look at all this data that you just talked about themselves. Anyone can. And they don't. And either it's that they are, and they won't say anything to patients, and they keep saying it's safe and effective. And either they're just ignorant and haven't looked at the data, or worse, I think in a lot of cases, I don't know which is worse, but a lot of them are sort of onto it, I can tell, but they're scared to say anything. Because most doctors today, at least in our area, are employed by big medical centers, big healthcare networks, and they are told, I mean, you cannot say anything negative about the vaccine. You'll get in trouble. And that is what, as a physician of, let's see, how many years, 46 years, this is what disturbs me no end. It bothers me when I go to sleep at night that doctors are calling someone like you a purveyor of disinformation when they themselves are just absolutely lying. Either, well, they may be intentionally lying or just ignorant. But either way, it's disturbing, and I'd like your comment on this, that you can't trust the medical profession anymore. If they can't see what you see and say something, then what good are they? How can you trust them?
First of all, I just want to commend you on your courage. I mean, it takes a lot of courage to do what you did, and all the frontline doctors and people like you, I just have immense respect. And by the way, when people like you started to get attacked and maligned, again, I'm a critical thinker. I'm like, that's interesting. I want to know what they're saying. And of course, what you guys were saying resonated with me because you were looking at data and truth, and that's all we can do. But I think part of the problem, let's go back to Obamacare. I don't think people really understand what happened with Obamacare. We basically have a single payer system. We just don't know it. And you said all these people are employed by these big medical companies. Obamacare was designed to push doctors into these big corporations. And once you start that, you now have what I call administrative medicine. So there's all these protocols from the top down, and doctors don't have as much latitude as they used to make, their own decisions for their own patients. It's a one size fits all. And so the power that's been aggregated since Obamacare into the hands of the administrators is, I think, a big problem here. Now, the doctors like that you called out, they're one of two categories. They're ignorant, they're blissfully ignorant, willfully ignorant at this point, I would say, or they're cowards. And if they know, they're cowards. And because the FDA, and you've been a doctor for a long time, there's a lot of trust and faith in the FDA. And if the FDA says it's good to go, they don't question it. Because I was talking to a Wall Street professional who was a doctor, and her job was to analyze clinical data for her clients to tell the clients whether or not there was statistical significance in the results. And she saw this like you did. And I asked her, I go, do a lot of doctors out in the field know how to read clinical data? And she laughed. She said, no, most of these guys don't have any clue how to read a clinical study. So it's a problem. It's kind of a high priest system where the FDA says something and they have the cover of the FDA until otherwise stated. So that's the problem. doctors like yourself that used to practice medicine individually for each client, and there's not one size fits all. They're a rare breed these days. That I think is the biggest problem. The seeds of what we're seeing today were sown in Obamacare, in my humble opinion.
Yeah, and I think also, yes, that's a very good point. I think also what I've seen in medical education, I went to NYU medical school back in the 70s, and we were really taught to analyze, to think for ourselves. Now they're not. They're really taught to be sheep, and they're also taught to focus on all these issues, which to me had nothing to do with medicine, such as diversity, equity. This is what they're being indoctrinated into. And so they're an indoctrinated bunch who seem to have lost any ability to think critically. And this was exactly why I went into medicine, because I wanted to be a person who would do that, and realize now that's all being lost. And it's a very sad thing, because as I now, I'm 70, as I approach, and Bob is a little bit behind me, as we approach our older years, we're going to depend on having doctors that know what they're doing, that are thinking. And I don't know where I'm going to find one. I mean, I make a joke about it, but it's not, it's serious.
Well, I agree with you. And, there's going to be a new system that grows underneath the current system, and it's already happening. Doctors like yourself are aligning, and I think the healthcare insurance system is going to fall apart due to what just happened with the vaccinated. It's going to be the system's going to be overwhelmed, and a lot of the professionals in healthcare took the vaccine themselves. So we're going to have a shortage of healthcare professionals, and people like yourself are going to break away from the system and create new modalities, and it's going to become private pay, unfortunately, but that's the way it's going to go. And I think there's tremendous opportunity for people like yourself. That I look, in the seeds of destruction, there's always something good, and I think there's going to be a new way of doing healthcare.
Joseph Schumpeter, creative destruction.
Correct. The other thing, we need to think about, we talked about this single payer system. It's come to light, and I think this has been verified. Blue Cross Blue Shield gives bonuses to doctors that vaccinate either flu or COVID, doesn't matter. So they're incentivized monetarily to vaccinate you. So there's a money component to this as well, not so much a health. It's like they get paid more if they push it. I mean, you can't make this up. I wasn't even aware. I just thought they were doing what they were told, but they get money to do this.
In your book, Cause Unknown, have you gone further and done some follow-up on these deaths and seen if anybody anywhere has autopsied or studied what happened and what the causation is?
We haven't gone into that data, but we just did so we're continuously updating our data. This is what I call an active current fraud. We're witnessing a fraud, and it continues. So we constantly update our data at the Humanity Project, which is found on our website, financetechnologies.com, spelled PH instead of F. And we just put out a report last, Zurhedge picked it up on Monday, where we link the real world disabilities to the clinical trials statistically. So basically, what happened in the clinical trials, the adverse events, even with their narrow definition, occurred at the same order of magnitude that we're seeing in the real world. And so they knew then, even in the 2 months of the clinical trials, the adverse events, they knew then that this thing should have been halted, but they decided to roll with it anyways. So we're continuously monitoring and doing work. And at the end of this report we did, that can be found on our website, we called for either a new clinical trial, a halt to the current vaccines, a new clinical trial, or autopsies. So we need autopsies. The problem is, I spoke with Dr. Malone about this. The system's just not set up to perform autopsies. It costs a lot of money. So somebody somewhere needs to start funding autopsies, and we need to do some serious investigatory work. I'm of the opinion, I know what the answer is going to be, yes, the vaccine is doing this, but we need this hard data to, prove it to those who don't believe it, what we know and believe.
We actually do have some of that. In Germany, there was a study, I think about 50 people that died right after the vaccine, and they found well over half of them had clear-cut evidence of clot or myocarditis, things that you could easily link to the vaccine. So they showed that it already in that small sample, but of course it's being ignored. The other thing that's being ignored, I want your comments on this. So you talk about the deaths, the disabilities from the vaccine. That's one thing. But we're also told that the COVID vaccine protects you from serious illness, death. And I don't know if you've looked at data from a lot of the heavily vaccinated countries. And I'll give one example, Japan, which is vaccinated 80 some odd, 90%, something like that. And you can see that after the vaccine rolled out, COVID deaths dramatically rose. So anybody who tells you that, well, COVID deaths are going to go down, they should go down after the vaccine, right? Instead, they went up dramatically in 2022 when they had vaccinated most of the population for the Olympics in 2021. That was their motivation. And I'd like your comment on that. It appears that it's a double whammy. It's not only making you more likely to have a cardiac event or something like that, but also to get sick or even die from COVID.
Yeah, so there's a lot of work. Again, I'm not a doctor, but it seems to suppress your innate immune system, so that and makes you more vulnerable to continuously get COVID. Gives you more chances to die from COVID. And Japan's an interesting case study because they didn't start vaccinating until later, and that's when the deaths started showing up.
That's right.
And that's very interesting.
Yeah.
And I find that very curious. It's a curious case of Japan. And
well, but you see it in other countries. You see it in South Korea.
All of the countries. But what's great about Japan is they started vaccinating well after others. So that's it's because people can make arguments about COVID, but now Japan waited, then got vaccinated, and now the data is showing up. The other thing I want to hit on what you said about it prevents serious hospitalization. Let's go back to what was originally said. You won't get COVID, and it'll stop transmission. That turned out to be a lie. So then they morphed the talking points from that to this new thing of serious hospitalization. I've yet to see. I ask on Twitter, and I say if anybody has a peer-reviewed study that proves this, I'd love to see it. We don't have one. It's what I call a pharmaceutical marketing talking point. It's a talking point that is repeated enough by doctors and media that people think it's a fact, but it's not a fact. It's a marketing point. It's meaningless. There's no data. It's garbage. I've yet to see a study suggesting this, and they won't produce one because there isn't. The data won't give them that result.
Well, and the real fault is, of course, the FDA didn't ask or demand that Pfizer and Moderna do these kind of studies. A randomized study, which is the only real scientific way to do it. Their randomized trials were ridiculous. They stopped it in 3 months and let all the unvaccinated people get vaccinated. So you don't have any real long-term data. So you really can't answer any of these questions from their studies. And should have been. That's where the answers should have been obtained.
Well, I would submit to you they destroyed the placebo group on purpose. Yeah, I mean that's why they did that.
They didn't want to have that. Would be right. That would be an unfortunate thing for them to have to explain.
Yes.
Yeah.
And they I remember when they did that, they said, "Oh, this COVID's so deadly, we have to give this to people," and they're you know the story. It's
right. And yet, so few people in that trial actually died from COVID.
Oh, I know.
And as we know, apropos to your point, the line you were talking about, they were telling us 2-3% of the people who get COVID are going to die. It turns out to be more like 0.1% there. Right? They grossly exaggerated that. And scare you into getting the vaccine.
Grossly exaggerated, and I focus on the vaccine, but there's a whole story that goes up around 2020 with the prevention of early treatment. We could have saved a tremendous amount of lives with protocols from already repurposed medicines. And that's why they malign hydroxychloroquine and ivermectin, because you can't have, this is something people need to know. The EUA for the vaccines could only be issued if there was no other treatment. So that's why they basically suppress treatments. And I don't know what the number is. I've heard the number 400,000 people could have been saved in the US in 2020. About 500,000 people died in 2020 excessively.
Well, interestingly, even worse, that you're talking about prescription drugs, hydrochloroquine and ivermectin.
Yeah.
Vitamin D was shown in a study by Johns Hopkins, hardly a radical organization, to be so effective in decreasing your risk of getting sick from COVID that they estimated from that alone, 150 to 200,000 could have been saved. Just vitamin D alone, which I remember, along with ivermectin and all that, was being poo-pooed as being, just a waste of your time.
Well, yeah, and I know a CDC whistleblower I'm in contact with was trying to push vitamin D internally, and she was blown off, as you might suspect.
Right.
I live on Maui in Hawaii, lots of vitamin D just walking around. And curiously enough, were there COVID cases on Maui? Sure, but we had some of the lowest amount of COVID cases during 2020. I suspect because COVID was actually on the island in November, December of 2020, because everyone got this mysterious thing and was sick. And then when the lockdowns occurred, we already had natural immunity because we were already exposed early. And, again, no one I knew in my group got COVID in 2020. I heard of people who knew people who got COVID, but again, vitamin D is all over Hawaii. So you're right on vitamin D. I mean, just the mere fact that we, can't avoid the sun here. There wasn't really much COVID in 2020 on this island.
As a money guy, how much money are the drug companies making or losing with this vaccine?
Well, let me give you the math. So Pfizer's revenues pre-COVID vaccines was about 40 billion. It grew to 90 billion. It took decades to get to 40 billion. And then in 1 year, they more than doubled their revenue. I did an analysis. We got to go back to 2021 because the plan was, if you remember, quarterly boosters. That was the madness they were going to push. I did the math on that. If Pfizer was able to execute on that, and I made some assumptions. They got 5 billion people on the planet would get vaccinated out of the 7. Pfizer would get 50% market share. I found out what they were charging for the thing, and I said, okay, if they're going to do this quarterly, what would that result for revenues for Pfizer on a 1 year basis? 360 billion with a B. So if you don't think people are compromised and bribed, you're naive. I mean, they would have been bigger than Apple's revenues.
Yeah.
Well, we're winding down on our time limit from Zoom. So I wanted to have you give out any information that you think people can use to stay in touch with what you're saying and the information you're putting out. So could you repeat your website again and any other information you think will help people keep track of what you're doing in your work?
Right. So all of our excess mortality and disability data for most of the Western nations is at financetechnologies.com. That's PH instead of an F. And we have what's called the Humanity Project on our website. That's where all the data resides. I also have social media. I got Twitter at Dowd Edward, DOWD Edward, and Getter at Edward Dowd. I post simultaneously in both platforms, and I drop a lot of our new reports there. So you can follow me there for the most current updates.
Well, Edward, thank you so much, not for only being on this program, but just everything you've done. Just like Dr. Katz, and more so, I have to say, you are a hero. And your book is Cause Unknown. And it seems that people just never learn. In 1936, Zev Jabotinsky told the Jewish people to get out of Europe. And they laughed at him. They thought he was a conspiracy theorist. And of course, at the end, we knew who was right and who was the conspiracy theorist. And this, people say, oh, you're comparing it to the Holocaust. Well, there's all kinds of levels of Holocaust. And it's always the same story. People like yourself try to warn, and very few listen. But your families are at stake. Protect your families. There is no more important goal